My name is Fazira Hairina binti Rosli. Today I'm going to present the topic of schizophrenia. It's part of my topic in clinical practice and mental health. Alright, the definition of schizophrenia. Schizophrenia is a mental disorder that affects how a person thinks and feel, that causing symptoms like delusion, hallucination, disorganized thought, and reduced emotional expression. It usually starts in late teens and early childhood. The exact cause is unknown, but it is a thought that involves genes, brain chemistry, and the environment. And the treatment including medication, therapy, and support, and help manage the symptom by helping them manage the symptom and enhance person's life quality. Okay, according to the WHO, schizophrenia is a mental disorder where a person experiences significant problem in understanding reality and shows changes in behavior, including persistent delusion, persistent hallucination, experiences of influence or control, disorganized thinking and speech, highly disorganized behavior, extreme agitation and slow movement, and negative symptoms such as limited speech, restricted emotion, social withdrawal, and reduced interest or pleasure. Additionally, people with schizophrenia also often have ongoing difficulties with memory, attention, and problem solving. Around 1 to 3 of individuals may experience a period of complete symptom relief, while others may have symptoms that worsen or improve over the time. Okay, the prevalence and impact of schizophrenia. The prevalence of schizophrenia affect around 24 million people worldwide, and approximately 1 in 300 individuals, equal to 0.32%. Among adults, it is about 1 in 222 people, equal to 0.44%, and more common in the late adolescent than early 20s, often starting early in men than in women. The impact of schizophrenia causes significant distress and disrupt various aspects of life, such as personal, family, social, and occupational areas. Okay, the symptom of schizophrenia, they can have a positive symptom, including delusional, when they think something that is not true, such as they think that they have superpower, like that. And then the hallucination, which is they see and hear something that is not there, not true lah. And then the disorganized speech, they also grows disorganized and abnormal motor behavior. And then the negative symptom, we have affective flattening, alogia, anhedonia, asociality, and evaluation. Alright, affective flattening is they tend to have lack of emotion. Alright, and then the alogia, they tend to have limited speech, and anhedonia, they have lost interest, and the asociality, they have difficulties in socializing, and the evaluation is they have low motivation. Okay, the cognitive symptom is the impairment in attention, which is they have difficulties in focusing in certain tasks, and then working memory, and the executive function. Okay, the type of schizophrenia have 5, which is paranoid schizophrenia, disorganized schizophrenia, catatonic schizophrenia, undifferentiated schizophrenia, and the last one is residual schizophrenia. Okay, the type of schizophrenia. First one is paranoid schizophrenia. It is predominantly categorized by a paranoid delusions and hallucination. Delusion all often involve themes of precaution, grandiosity, or conspiration. Individual may experience intense anxiety and fear, leading to defensive and hostile behavior. Okay. In the functioning, cognitive, and affect emotional expression may remain relatively impact compared to the other subtype. Individual with schizophrenia might maintain better social and occupational functioning. Okay, the second one is disorganized schizophrenia. Disorganized schizophrenia refer to the disorganized speech and behavior. They may have speech incoherent or illogical, that making difficult to understand or follow. The behavior can be unpredictable and inappropriate, and affective flattening is common. Okay, how they functioning? Usually they impair daily functioning, include self-care and social interaction, and they have difficulties in performing tasks and activities effectively. Okay, the third one is catatonic schizophrenia. It refers to the range of motor abnormalities. It may include motoric immobility, we call it stupor, and excessive purposely motor inactivity, waxy flexibility, where limbs can be molded into the different position and held in that posture. Okay, how they are functioning? Usually they are severe impairment in daily activities due to extreme motor disturbances, and can have difficulty in responding appropriately in the environment. Okay, the fourth one is undifferentiated schizophrenia. This individual don't meet the specific criteria for other subtype, but still exhibit symptom of schizophrenia, which is they may have mix of positive, negative, and cognitive symptom, but not enough for the clear subtype classification. Alright, that's why we call it undifferentiated. They are mix of all the symptoms. And the functioning is they impair functioning due to the variety of symptom, but lack in specific symptom pattern for the other subtype. Okay, the last one is the residual schizophrenia. Typically follows a period of active symptom, but now primarily characterized by mild or absence of positive symptom. They also may experience negative symptom or some cognitive impairment, but in a milder level. Their functioning impairment may still be present, but often less severe compared to the other acute phase. Okay, now the etiology and risk factor of schizophrenia. Schizophrenia can be due to the genetic factor, neurological, neurochemical factor, structural brain abnormalities, and psychosocial factors. Okay, from the genetic factors play a significant role in the development of schizophrenia. Research has shown that individuals with a family history of schizophrenia or other mental disorder have higher risk of developing schizophrenia themselves. And the genetic predisposition increase susceptibility, but does not guarantee on the onset of schizophrenia. Okay, and then the neurochemical factors associated with the imbalance of a neurotransmitter, which are chemical that transmit signal in the brain. The dopamine dysregulation hypothesis suggests that excessive dopamine activity, partially in certain brain region, contributes to the positive symptom like hallucination and delusions. And the other neurotransmitters like serotonin, glutamate, and GABA may also play roles. And then we proceed to the structural brain abnormalities. People with schizophrenia often exhibit structural brain abnormalities compared to the others who without the disorder. Okay, the abnormalities can include enlarged ventricles, fluid-filled spaces, reduced gray matter, greater volume and altered connectivity between brain region. The neurodevelopmental hypothesis suggests that these structural changes may begin during fetal development or early childhood. Psychosocial factors refer to the environmental and social influences. This is due to environmental and social influences that contribute to the onset, exacerbation, or maintenance of schizophrenia. Stressful life events such as early life social, unstable family environment, and urban upbringing are some of the examples from the psychosocial factor. Okay, the social isolation and lack of supportive relationship can worsen symptom and impact overall well-being. Okay, now we proceed to the treatment of schizophrenia. We have 4 types of treatment that we can give for them. The first one is antipsychotic medication, psychotherapy, hospitalization and stress intervention, and community support and rehabilitation. The antipsychotic medication we give, also known as neuroleptic, it is primary class of drug to use to manage the symptom of schizophrenia. This primarily targets symptoms like delusion, hallucination, and disorganized thinking by influencing neurotransmitter in the brain. It also helps in reducing the severity and frequency of psychotic symptoms and enhance the person's ability to function in daily life. Okay, there are 2 types, which is typical antipsychotic, which is haloperidol and chlorpromazine, and the second one is atypical antipsychotic, is clozapine, risperidone, and olanzapine. The treatment of second schizophrenia is psychotherapy. Psychotherapy or a counseling involves talking with a mental health professional to address emotional and psychological challenges. It's also including those associated with schizophrenia. Okay, the cognitive behavior therapy. It is commonly used to help individuals manage symptoms and improve their coping skills. And then we aid in managing symptoms, improving the communication, addressing negative thought patterns, and enhancing problem solving abilities, and fostering a sense of control over one's life. Alright, we proceed to the other treatment is for hospitalization and crisis intervention. Here, we deal with the severe patient with severe symptom and who are experiencing a crisis may require hospitalization for their safety and stabilize their condition. This crisis intervention involve immediate and intensive support during acute period of distress or exacerbation of symptom. Okay, we also provide a structured and safe environment for stabilization, assessment, and adjustment of medication to manage acute symptom effectively. Okay, we proceed to the community support and rehabilitation for the treatment. It involves a comprehensive approach to support individual with schizophrenia in community and daily life. Here we also include various services like case management, vocational training, social skills development, and housing assistance. We also facilitate reintegration into society, improve daily functions, promote independence living, and enhance overall quality of life. Alright, now we proceed to the management and coping strategies. Management of coping strategies is medication adherence, coping skills and stress management, lifestyle changes, and support system. For medication adherence, refers to how well an individual or a patient follows their prescribed treatment plan, including taking medication at the right dose, time, and frequency. And then the important of this is in managing schizophrenia in order to prevent symptom relapse. Okay, in consistent medication adherence helps stabilize mood, reduce symptom, and enhance overall function. And the challenge for the patient is usually they have side effects such as forgetfulness, lack of insight into illness, and stigma may affect adherence. Alright, the strategy is we do the setting reminder involving family in reminding supervising medication using pills organizer, and understanding the importance of medication can aid adherence. Okay, now we proceed to the coping skills and stress management. Coping skills are strategies individuals use to handle stress, challenges, and emotional or psychological issues in a healthy and adaptive way. Stress management involves a technique to reduce and manage stress to maintain overall well-being. It is important for the patient of schizophrenia patient as they often face stress. Thus, developing effective coping skill and stress management strategies is crucial for them for symptom control and improve quality of life. For example, mindfulness, deep breathing, physical examination, relaxation technique, and seeking support through therapy or counseling and effective coping and stress management strategies. Okay. The lifestyle changes in management is refer to the modification of an individual's daily routine, habits, and behavior that can positively impact physical and mental health. Okay, it is important to adopting a healthy lifestyle for the patient for managing schizophrenia, as it is can complement medical treatment and enhance overall well-being. The component of the lifestyle changes include regular exercise, a balanced diet, adequate sleep, minimizing substance use, and engaging in meaningful activities that contribute to healthier lifestyle for individuals with schizophrenia. Alright, the support system in managing and cope strategies comprise people, group, and organization that provide assistance, encouragement, and understanding to individual with schizophrenia. It is important having a strong support system for the well-being and recovery of the individual with schizophrenia, by as helping them can navigate the challenges and maintain treatment adherence for the patient. The types of support that we can give is family support, peer support group, therapy group, and mental health professional are vital component of the support system for individual with schizophrenia. Alright, now with prognosis and recovery of schizophrenia. Okay, this is the case study of schizophrenia that I'm doing for this clinical practice. Is regarding Mr. Salahuddin bin Osman, a 24 years old Malay male. He had trouble involving substance abuse and abnormal behavior. In 2018, he was detailed under the National Anti-Drug Agency's AADK for 8 months due to active drug use and related abnormal behavior. And his history of substance abuse dates back 3 years. And he exhibit aggressive behavior and evidently by destroying household item and a court case for a car theft. As he additionally, Salahuddin has a history of self-harm and engaged in a substance abuse, including smoking cannabis and methamphetamine, which is ice. Alright. For the management, on 22 of September 2019, Salahuddin showed improvement and was referred to the occupational therapy for employment opportunities. However, he later experienced insomnia after substance use, resulting in increase in olanzapine dosage to 10 mg once nightly. During subsequent assessment, medication adjustments were made based on Salahuddin's symptom and behavior. On 11 October of 2021, he was admitted due to auditory hallucination, and his treatment plan is include IM Modicate and oral olanzapine. And then we continue the home visit to assess his progress and ensure his well-being until now lah, 2013. He has actually home visit patient. Alright, that's all from me. Thank you.